We were talking last week about the outbreak. Well, it wasn't an outbreak of listeriosis at the time. We do now know that it's listeriosis, but the outbreak regarded almond milk, coconut milk, almond coconut milk, and oat milk under the brands Silk as well as Great Value. The recall happening a few days ago, and there are now two deaths from listeriosis associated with this outbreak. So do be conscious of those brands. You can go to CTV News Montreal or CJAD, the websites, to get the details. But again, Silk and Great Value brands are affected. Soy milk is not affected, nor is cow milk. These are very specific types of milks. But what is listeriosis? How do you spot it? And can you do anything about it? Obviously, you have to go to the hospital right away. But let's speak to a doctor on this. Dr. Matthew Oughton is a physician in infectious diseases at the Jewish General Hospital. Dr. Oughton, thanks for joining us.
Well, thanks for having me on today.
Do you see it coming, listeriosis, or is it? How can you recognize the signs?
So listeria is a bit of an unusual infection in a few ways. I guess, first of all, like many other infections that your listeners might be familiar with, it's one that can go from almost minimal symptoms to really, really severe and, like you mentioned in the intro, even life-threatening disease. So it really has quite a broad range, poses a threat to, well, it can make anybody sick, but the groups that tend to get are more likely to have severe disease include newborns. We're talking like the first few days of life, as well as people who have a lot of medical illnesses, people who are immunosuppressed, things like solid organ transplant patients or people who have HIV that isn't well treated. And it can really present in a few different ways. Probably the most common way, and I guess what is germane to the current recall, is it's one of the foodborne illnesses and can present with a lot of the usual symptoms of gastroenteritis, stomach upset, stomach and intestinal pain, diarrhea. But also it can be an invasive bacteria and sometimes get into the bloodstream and even cause meningitis. And that's really the form that's a lot more potentially severe, and sometimes 4, even up to 5% of people who get that form can die from it.
Well, that was my question, Dr. Oughton, is how do we distinguish between food poisoning, sort of classic food poisoning, and listeriosis? How are the symptoms different? And is it really just at that point where it goes into or can cause meningitis, or are there signs before then?
The signs for the gastroenteritis version look a lot like the food poisoning symptoms that I think most of your listeners are probably familiar with. Here we are in the middle of summer, picnic season, and people, bringing out the picnic baskets and the cold cuts and everything else. And this is something that continues to pose a threat. And honestly, a lot of the symptoms of gastroenteritis caused by listeria are exactly the same like other symptoms of food poisoning. So and probably most times people who get a listeria infection, it'll last a few days, it'll go, and it will be just like any of the other, perhaps more frequent bacterial infections, the same sort of collection of symptoms, diarrhea and stomach cramps and whatnot.
In this case, the outbreak resulted from, I suppose, industrial process, plant-based milks. Does it come? Is it born in certain foods more likely than others, or is it certain facilities maybe? Or
that's a very good question. So one of the unusual things with listeria is it's one of the few human pathogens, the bacteria that can cause human disease, that is actually quite happy at refrigerator temperatures and can even multiply at refrigerator temperatures. That's why we use refrigeration for a lot of our foodstuffs, is that greatly slows down the rate of multiplication of many other bacteria and fungi. But listeria absolutely love that temperature. And that's also partly why you tend to see it often connected with foods that are refrigerated. Some of your older listeners might remember that it was actually quite a sizable outbreak about 15 years ago, 16 years ago now, 2008, that was connected with deli meats and cold cuts. Now we have the current food recall that's linked to the almond-based milks, again, foods that are really kept in the refrigerator. So that's one of the things that I think catches people by surprise. Another thing is that unlike other things that can spoil foods, and the food is obviously either sort of discolored or smells funny or looks funny, but when food is contaminated by listeria, and it's sitting in the fridge, it can look exactly like an unspoiled food. So there's not those same sort of visual or olfactory warning signs.
Quite concerning for somebody like me who drinks a lot of plant-based milk. Um, is this something that is more likely to occur in certain foods more than others, such as plant-based milk? Like, how does it present in other foods, for example?
I'd say one of the unusual features about this current recall is that I don't think there have been many, if any, reported outbreaks of illness related to, or at least listeria illness related to plant-based milks. I mean, kind of ironic. Most people choose these products as being part of a healthier choice,
Right.
and yet at the same time, as it turns out, probably due to some problems with cleaning or sterilizing. These are products that people keep in the fridge for, sometimes days, but sometimes weeks. And then just compounding the challenge is that even after you consume it, sometimes it can take several days, sometimes even a few weeks before you really develop any symptoms. And of course, sure, you might present to a doctor or to a hospital at that point, but trying to recall all the foods that you've eaten in the last few weeks, you can see where it might take a long time before there's enough data to start to flag the possibility of one particular food thing that's connected to multiple cases.
Ultimately, what's the symptom, or how bad do things have to get before you go to the hospital when you have some sort of stomach issue?
I guess a few things. So, and I don't think I made this point earlier, is pregnancy is also considered a risk factor both for the mother as well as for the unborn baby. So certainly if you are pregnant, if you are immunocompromised, if you're on medicines that work by suppressing your immune system, and you start to have symptoms of invasive listeria infections. So to my mind, that's things like fever, headache, stiff neck. You should really get yourself to the nearest emergency room right away for evaluation. I think probably this disease, although it's not the most common disease under usual circumstances, I think with the recent recall, I think it's on the radar screen, and I think a lot of physicians will be wondering about that, may ask some specific questions, and then we do have a multitude of different tests that we can do if we want to look specifically for this.
So, Dr. Oughton, in terms of a spike, we heard today that President Biden has it as well. Are you seeing a spike at your hospital?
It's complicated. Your viewers probably are familiar with some of the tools that we used to have to sort of more closely track what was happening with this disease in the community. And these days, we really don't have a lot of solid real-time data. Maybe the two things we have are hospitalizations connected with COVID-19, as well as we're still doing the wastewater screening that thankfully the province has still been keeping up with. And if you look at the wastewater, it's pretty clear that here in Montreal, we now have higher levels of COVID detectable in the wastewater than we've had since January of this year, which usually that's a reflective of the amount of COVID circulating in the community. And I mean, for what it's worth, anecdotally, it seems like there's a lot of people who are sick with quote unquote a virus, but in July in Quebec, there's not that many respiratory viruses circulating at large numbers other than COVID. So it's all sort of indirect, but it certainly makes you think that there's a fair bit of disease, at least at the community level. But thankfully, that doesn't seem to be a major contributor towards severe disease, to the point that the hospitals are being overloaded with severe cases of COVID like we were a few years ago.
Thanks for that update. Yeah, I mean, I've definitely seen a couple of cases in my immediate circle. So, and of course, Joe Biden as well now saying that he's come down with COVID. Is the COVID virus, just quickly, is it something that is as much of a threat, or how is it presenting itself at this stage?
It's a good question. There are a couple of circulating variants that it's felt are quite contagious. Like I was mentioning earlier, contagious is part of this, but doesn't seem to be translating into cases that are, on average, as severe. But I stress that concept of on average, right? Because people who have already a baseline really bad lung function, people who have really weak immune systems, right? A case of COVID for them may be a lot more severe than a case of COVID for someone who's in otherwise good health. So it's a bit of a tricky equation because you can't sort of make one blanket assumption that covers all people and all situations. I am looking forward, hopefully, this later on this autumn, maybe here in Canada, maybe it'll be late September or October, we should be getting an updated vaccine that, just like the last time the vaccine was updated, will more closely mimic the circulating strains and therefore provide better degrees of protection, especially for people who are at higher risk of disease and those people who are, in their immediate circle.
Just the other day, we're going to end on this. Thank you for your time, Dr. Oughton. But the Quebec Director of Public Health, I think, was suggesting that we may even see it late in the summer, that new vaccine. But is that a concern, or do you think people who need the vaccine should just go ahead and get the one that's available to them?
Yeah, that's it. It's the question of bird in the hand and two in the bush, right? That as far as I understand, right now there's still the idea that if you get either a COVID infection or a vaccine, then you need to wait ideally 6 months to sort of maximize the benefit before the next vaccine, which again we are theoretically going to get sometime this maybe end of summer, but I would think it's probably more likely in the autumn. So you have that sort of trade-off of, do I go with what I have right now, knowing that it might be giving me some protection, but not as much as the new vaccine that should be coming here in Canada, but we have seen, I'll remind your viewers, in the sort of months and years before, that sometimes approval of new products in some countries like the States isn't immediately reflected by approval of the same product here in Canada. So there's all these factors, and it becomes, I think, a very hard decision. Probably the best advice I can say is for people to discuss with their immediate primary health care provider to try to make the decision that makes the most sense for them in their current circumstances.
Dr. Matthew Oughton, infectious diseases at the Jewish General Hospital. Thank you so much.
My pleasure. Have a good afternoon.